as a coordinator of VRUNDAVAN Health Quiz, I extend a very warm and cordial welcome to each one of you present over here. Well, students, you are here from morning and you have participated in the preliminary round, right? And how was the paper, by the way? Was it easy? Difficult? So? Okay. You'll come to know the score now. And of course, I will not announce the score of each and every individual or the higher secondaries. But if you want to know your score, you can get the score from the reception counter while going. Individuals to excitement असताना थोडेसे की आपण किती पडलेला म्हणून. So you can come to know from the score at the reception counter. Well, I once again extend a very warm welcome to you all for the 15th edition of VRUNDAVAN Health Quiz 2024. Friends, this has been supported by VRUNDAVAN Institute of Nursing Education, VRUNDAVAN Institute of Paramedical Technology, Rotary Club of MAPSA, Indian Red Cross Society Bangladesh branch and Directorate of Art and Culture. Live telecast by our media partner Sagar Varta, ICE Goa News and Goa TV and Shabda Sharda. So as I said, the program is live on the Facebook. You can always enjoy this program on the Facebook. Entire program will be covered by these media partners. So are you all excited to know the result? Yes? Louder? Yes, everybody is excited to know the result, and as I said, the result is here with me. Let me take the opportunity to announce this result and welcome these teams. As you know that only 4 teams will be coming on the stage and occupying the hot seats here to participate in the final round of VRUNDAVAN Health Quiz. So you can start guessing. As I said, this result is prepared on the basis of total score of both the students. Okay, not considering only the total of the highest, total of both. So let me welcome. The paper was out of 100 marks. So the total, when I say, this is out of 200 what you have scored. And individual also I will announce. The first team to qualify in the finals of VRUNDAVAN Health Quiz. Let's give a big round of applause to Mustifat Higher Secondary School, Bambolim. And the participants are Mayang Vasudev Bangji and Siddhi Sagar Bhosle. The total score is 145. Big round of applause to both the participants. Mayang has scored 75 and Siddhi has scored 70 marks. May I now request both the participants to please come and take your seat on the dais. We will call you as Team A. Please come. Once again, big round of applause to both of them. Come on. Mayang and Siddhi, please take your seat. The second team to qualify with a score of 136, very close by, Sri Shantadurga Higher Secondary School, Bicholim. Participants are Shravan Kasar and Sanisha Malik. Shravan and Sanisha, please. And both have scored equal marks, 68 and 68. Did you copy from one another? No. Here, please. The team B. Yeah. Now, any guesses for the third place? The third team to qualify with a score of, again very closely fight, 132 score total. Santa Cruz Higher Secondary School. Santa Cruz. Participants are Riyansi Dice and Gautam Bandodkar with a score of, again, both have scored equal, 66, 66. I don't understand how it can be same. You are sitting next to one another? No? Okay, fine. And now, the fourth team to come on the hot seat is from People's Higher Secondary School, Tangin, Sanvi Joshi and Disha Prabhugaonkar. with a total score of 131. Sanvi has scored 66 and Disha has scored 65. Please take your seat. Let's give a big round of applause to all these 4 teams which have qualified in the finals of 15th edition of Vrundavan Health Quiz. Right? And big congratulations to you all, because you have also equally done very well. Well, I think that your score may be little here and there, little less, and therefore you could not come on the hot seat. But nevertheless, these people are going to get the prizes, of course. But at the same time, let me also assure, you can also win so many prizes by participating in this quiz. How? Because doctor is going to conduct a round specially for audience. And sometimes when they cannot answer, the question will be passed to the audience, and if audience answers, you will be getting the prize. So don't worry, don't get disappointed for not coming on the hot seat. You are the winners also, as I said in the morning, right? So let's give a big round of applause to them also, because they have also done equally good. Well, these are the 4 teams that has qualified for the finals of 15th edition of Vrundavan Health Quiz. Well, now, so let's begin with the quiz. And to begin with the quiz, let's welcome the mastermind of this quiz, none other than the director of New Vrundavan Hospital and Research Center, and the quiz master of today's, none other than Dr. Digambar Naik. Let's give a big round of applause. Dear students, you may be participating for the first time or second time, but let me assure one thing. Today, when you go back, you will be full of knowledge. And I'm sure that these students who are sitting here, maybe they are planning to be the future doctors. And if yes, and here also there are so many, you will go with a lot of knowledge which is required to answer for your NEET examination. You can ask any question to doctor, and doctor will be there to answer your doubts, right? So once again, let's give a big round of applause and welcome Dr. Digambar Naik, the quiz master of today's.
Good morning, good afternoon, good evening. I know you've been here since morning, and I couldn't wish you good morning. Now it's good afternoon, and you will be also with me for good evening. Friends, let me tell you, this time last year I thought I had given a little lighter paper. This time I created one of the toughest paper. And am I audible? Put off your mics, huh? It's direct. Okay.
Yeah, the 2 mics are direct.
But this time I created one of the toughest paper, and I was surprised to see a maximum score of 82. Let me tell you, tomorrow, I think next week, I'm going to create a similar, almost the same paper with the doctors, and they will not score 82 marks. So my young friends, you are so good. Good in what? Good in your knowledge, good to become doctors, and you are good, you will be very, very good in your NEET exams. Half of these questions will appear somewhere into the NEET exams. So this was almost like a small introduction to you to your NEET exam. Do not get scared. If you score this much, you will easily go through your NEET exams. Let me tell you, this is 15 time, 15 into 8. How many students have sat on the hot seats? And I was just trying to get a statistics, and let me tell you, more than 60%, I couldn't get a whole statistics, but more than 60% of those who were on the hot seat have already become doctors. And many of them came and connected me. Okay? How many of you are planning to be doctors? 1, 2, 3, 4, 5, 6. Not you? Not sure or don't want to be a medicine. Anyway, 6 of them, out of 8, 6 of them are wanting to be doctors. All that you got to do is just stick on to your proper training, concentrate yourself, okay, listen to your parents. I know today children don't want to listen to their parents. They say, you don't teach us anything. And even if your parents can't teach you, their blessings are more than enough. And in NEET examination, friends, let me tell you, you all need a lot of luck. Lot of luck. Okay, so you all need a lot of blessings in NEET examination. Okay, so shall we start with the team? With the quiz? Yes? Okay. Can you go to the next slide? These are a few of the books I've written, 9 of them so far on health, and these are for common people. And there are some books I've kept here. One of the book will be inaugurating today, and I've also brought some books from the publishers and kept them on the reception outside. You can buy them out. Okay, so let us go to the next slide. Okay, before we go to the quiz, let me tell you what is health. Before 1948, for us health was absence of a disease. If you did not have a disease, you were called healthy. But this is not so. The WHO realized in 1948, WHO brought this definition which said the health is a state of complete physical, mental and social well-being and not merely the absence of a disease or infirmity. This was okay up to now. Till now, no one has tried to redefine health. Today, for us, we know we are looking at health or anything else as quantum physics. What is quantum physics? When it comes to quantum physics, it is physics, biology, chemistry is all one. You are going into the depth, into the infinity depth, and then we realize we are not the solid body that we see, that our eyes perceive. We are all a part of energy. When you start dissecting your atoms, you know what is an atom? There's a proton along which an electron is moving. And then you go down, you have subatomic particles. So you go down to that level. At that time, we today realize we are just a part of an energy. And your whole universe is one part of energy, just an energy. And we are a part of this energy. Whatever energy you call this, some call it God, some call it in different name, that is just one energy. And we are a part of this energy. And what is our good health? If I am in synchrony with the energy of the universe, I am obviously healthy. Okay, so here is the definition I have created for the health. First time that this definition is created by me. Health is not just an absence of a disease or infirmity. It is a well-being of every function of your body, maybe physical function, maybe physiological function, psychological function, social function. If I can't go well with my neighbors, can I be healthy? I'm not healthy. Okay? As well as economical. If I don't earn sufficient money to sustain myself, I cannot be healthy. Okay? It is a balance of you as a bunch of all these functions vis-a-vis the universe. It's your synchrony with the universe. It's a smooth play of your energy with the energy of the universe. Once you create this balance with your universe, your spirit, your energy will start vibrating in tune with that of the universe. Obviously, your body at this time will be full of pleasure and joy. the ultimate joy that we struggle for. This, my friends, to me is the definition of health. And if you look at this, you can definitely try to balance yourself and try to create this health. At that time, no disease will touch you. Your body will not have diabetes. Your body will not have the heart problem. Your body will not have cancers. Your body will not have any disease. All the time, you will be full of vibrations. All the time, you will be full of energy. And you will be in synchrony with the universe. Okay? Remember this as a definition of health today. Okay? Yeah. Now let's start with a quiz. All right. All set. Okay. Now I'm concentrating in all four of you. I'm happy to see good smiles on both of you. And that your majority is girls, huh? Boys are outdated by the girls. Okay? Now, can you show me what are the different rounds? Okay. The quiz will go into these 7 rounds. First one will be audience in waiting. They will have a question, and if they fail to answer, the question will go to the audience, and whoever answers will get a very special prize. And that prize will be that special book from me. Okay? Alert, how to be alert, active, alive at the age of 100 without a disease. Okay? So let's see whoever gets this. But I don't want any prompting. I don't want you to talk. Please raise your hand, and I will decide whom to ask. Okay? And then accordingly, whoever answers will get that prize. Okay? Please don't murmur in between. Please. Okay? Because in between, if I find they have answered listening to you, I will cancel that question, and they will be the losers. Okay? Second round will be take a chance and passion, chance or pass on. So it will go from one person to another person. First question will get 100 marks. Whoever answers second will get 50 marks. I am the doctor, so you have to answer this. Believing that you are already the doctor. My career. Okay? Then there is a buzzer round. This is a round which really kills you. Okay? And then there is an audience question. I've got a few questions only for the audience. Okay? And then the last round is a rapid fire round, in which in 1 minute you will be given 10 questions. You have to answer them correctly. Except for the buzzer round, there are no negative marks. Okay? You can take your chances. Initially, let's go slowly. Let's start playing test match in the initial stage. In between, you will be playing one day, and last is your T20. Alright? So let's start playing. Come on. Let's have the first round. Audience in waiting. Let's start with team A. I'll go in team A, team B, team C, and team D, same sequence. Okay? Let's ask the question to team A first. Am I audible? Am I audible? Okay. Let's have a question. Alright. Mr. Arvind has come to the emergency room. You know what we mean by emergency room? He may be suffering from CCF, CKD, cirrhosis of liver, all of the above possibilities. Okay, question is to you. If you don't answer, the question will go to the audience. Please get involved into this question. Except for your buzzer round, there are no negative marks anywhere. You can definitely make your trial. Okay? Mayank, can you see it well? Okay? Otherwise you just shift yourself so that you see it properly, okay? Only you will have a little problem and you can see it. Okay? Take your time. I'll give you your time, no problem, Mayank. Siddhi is trying to prompt you. Who's smarter of the two? Ladies are always smarter, huh? There is no question onto this. Ladies are always stronger, ladies are always smarter. Don't consider female as a weak sex, no. We have proved with all biological things. The science has proved the ladies are a very, very strong sex. Which one you want to answer? You know what is CCF? I am not going to tell you. What is CCF, CKD? No, nothing, no help, support from me.
So option D.
Option D. Alright? Mayank says option D. Mustifan Higher Secondary School. You are representing your school, huh? You have to take these trophies for your school and also for you, okay? Alright, are you sure? Should I lock it? Computer, please lock the answer D, which says all the above possibilities. Very good. Excellent. Who gave you the answer? Siddhi gave you the answer? No? You decided, or both decided, okay? Now what is CCF? You're in the emergency room, okay? It's a casualty where doctors are there to help you for emergency. CCF is congestive cardiac failure. You're suddenly in the middle of the night, you become breathless. And you have to be rushed to the hospital emergency room to save yourself. CKD, chronic kidney disease. Same thing happens in kidney disease and cirrhosis of liver. People who suffer from cirrhosis of liver usually can start vomiting blood. Okay? And at that time you have to shift them into hospital as quickly as possible. That is called emergency. So your the answer is absolutely perfect and you get 100 marks for that. Okay? Let's come to team B now. Alright? I like your Sanisha's smile and Shravan. Okay? Alright. Can we have a question for Sanisha and Shravan? You are prescribed aspirin and clopidogrel for many years. You must have been suffering from. And many of you will have this patient in your houses, okay? Hemorrhagic stroke, thrombotic stroke, brain tumor, grand mal convulsion. Okay? Shanta Durga High School, Bicholi. Any idea where you give aspirin and clopidogrel? If you say somewhere in your family, somebody must be taking. Your parents, grandparents, uncles. It's a very, very common thing. Option A, hemorrhagic stroke. Are you sure? Sanisha, are you sure he is right? You have time. Okay? You're so sure that Shravan is very right, huh? Should I give the computer? Can we block the answer? Yes? Come on, computer. Block this answer A. Oh. Alright? Let's see in audience who answers. Give me one book. I'll have. Please put your hand up together. Up. Okay? Alright? Yes, let me begin with girls. Take a mic, okay? Everyone has to understand. Everyone is playing with me, okay? This is a game we are all playing. And these are the answers you all are supposed to be knowing. Brain tumor. Okay? So, computer, block the answer brain tumor. No. Okay? Now let me go to the boys. Come. I know your answer is easy. You only took yes or no answers now.
The answer is B. Thrombotic stroke.
Yeah, it is a thrombotic stroke. What is a thrombotic stroke?
When the thrombus clot travels in the blood, we use aspirin to slow it down.
Use your mic, yeah?
When the thrombus clot travels in the blood, we use aspirin to slow it down.
Very good, okay? Did I say very good before you answer? I hope I'm right, huh? Yes, computer, let's block this. Answer B. It's a perfect answer for you, okay? Who's going to give him a prize? Come, madam. Start with you. Okay. Come here. And then that portion of the brain gets damaged and you get your paralytic attack. In thrombotic stroke, there is a clot there. There's a blockage there. Okay? And that blockage stops the blood going to the brain. And the brain does not get blood and you get your stroke. So, hemorrhagic stroke is bleeding, thrombotic stroke is clotting. And if you look at these two medicines, aspirin and clopidogrel, these medicines are given to you to prevent clotting, to dilute your blood so that you recover from that stroke. And by mistake, and if you have a hemorrhagic stroke, we'll have to give you medicine that causes clotting. Hemorrhagic stroke is one treatment and thrombotic stroke is absolutely different treatment, opposite treatment. And if your doctor changes these two treatments, your stroke will worsen. So the first thing that you have to do, once you get a stroke, do not keep on giving anything. Take your patient to the CT scan. And that CT scan will tell you whether this is a thrombotic stroke or whether this is a hemorrhagic stroke. And then the doctor can give you the exact treatment, and if you can take that exact treatment in right time, you can completely save your patient. In right time. Every minute, once the artery is blocked, every minute it does not get blood supply, there is a damage to the heart. So, time is equal to damage to the brain. Time is equal to brain in any stroke. Okay, stroke can precipitate in any small thing, like your relation cannot talk, slutters, cannot lift his hand, or falls down, or develops a convulsion. It could, manifestation could be anything in both these strokes. And without doing a stroke, without doing a CT scan, do not start any medication to the person. Okay? Now let's come to team C. Gautam and Riancy. Okay. Santa Cruz High School, Santa Cruz. Okay? Come on, let's see your question. Wow, beautiful question. Huh? Ajit's urea is 75 milligrams per cell. And creatinine is 12.5. He has to be visiting which doctor he must be going to? A cardiologist, a pediatrist, a nephrologist, or a neurologist?
Option C.
Option C, nephrologist. Are you sure? Okay, I know Riancy have had you the answer. Okay, she's smarter. Okay, come on, computer. Let's block the answer. Nephrologist, option C. Absolutely right. Okay. Urea and creatinine rise means patient has got a renal kidney failure. Okay, and he will go to a kidney specialist who is a nephrologist. Okay, that's very good. Congratulations to you on the spot. Now let's come to two young girls. answer the question. Computer, let's have a question for People's High School. Which of the following, I know this is a pretty tough question, huh? Which of the following is a starchy vegetables? Your broccoli, capsicum, corn, or spinach?
C, corn.
Are you sure?
Yeah.
Yes, lock kiya jaye. Okay, computer, please lock. And I didn't remember. I said a very difficult question. So you're very sure. Please lock answer C, corn. Right? So we are talking about vegetables. Vegetables don't have starch inside, except your corn, isn't it? Okay, you can make a chapati or a laddu out of corn, or make your sweet corns or your munch corns when you are watching your movie, nah? Okay. So this corn have lot of starch. It is a vegetable, but it's not a normal vegetable. Say normally, if you take a gram of carbohydrate, it has 4 calories. If you take a gram of proteins, like your chicken and mutton, it has 4 calories. If you take a gram of fat, like your butter, cheese butter, it has 1 gram has 9 calories. And your corn falls into that, it has 4 calories. While if you take actual vegetables like broccoli, capsicum and spinach, 1 gram has just half a calorie. So people who want to reduce their weight should watch their calories. And if you take 1 gram of fruit, we'll have 1 calories. Okay? So round 1 is over? No. So in the first round itself, now we are coming with a second question. Okay? Are you ready? Okay? Mayank and Siddhi, here is a question for you. 1 gram of fat, like has dash calories. You are lucky. Give them the answer. It is just the luck. Huh? I shouldn't have explained you so much. Okay, fine. Did you know the answer? You didn't know it. A big clap for them. Big clap for the luck. Big clap for the blessings. Your life is made up of a lot of blessings. Okay, friends, learn to take blessings from your people. Learn to take blessing right from small children to your elderly in the family. The whole life, do not insult or do not neglect any elderly person in the world. And I'm sure both of you are always respecting your parents, your grandparents. This is how luck simply comes to you. I was just telling you, you need a lot of luck in NEET examination. Okay? So you are going to be pretty lucky in your NEET examination. Alright? So after team A is team B. Ready? Come on now. Come on. Okay. You got a very, very simple question. Huh? Key to healthy eating is moderation, variety, balance, all of the above. Look at this as key to healthy eating. Why you want Nisha? I want to answer all that. Why can't you answer? Huh? Sadisha? You answer now.
C, balanced diet.
B,
C.
balanced diet. Key to healthy eating is B. B is variety.
C.
C is balance. Okay? So your answer to this is C. Can we block it? Are you sure? Absolutely sure? 50-50. Absolutely sure. Both Shravan and Sanisha are absolutely sure that answer to this key to healthy eating is balanced diet. Right? Okay. Come on, computer. Show us the answer. Okay. So now, no, I'm not going to ask you now. Okay. So this time let me start on this side. Okay, who's there on this side? Okay. Teachers? Yeah, anybody can answer. Except nursing college and paramedical students. Okay.
So I feel it's D, all of the above.
I think it is due all of the above. Are you sure? Are you thinking or are you sure? Okay. Should we? You want me to block the answer? Yes, computer. Block kar do. Wow, perfect answer. Okay. Who's going to give you? Pradnya? Come here. Okay. Key to healthy eating. First is moderation. If you eat extra, you will develop big paunch, fattiness, and you will die early. If you don't have a variety, how will you get proteins, calories, and everything, and vitamins and minerals, and so many things that you need? Okay? And yes, your balance is always required. But just the word balanced diet means all this together. Remember the first thing, we always talk about balanced diet, balanced diet. It is all how much you eat. And all of you who are fat and who have a paunch are the ones who are eating more than what you need. Okay? Take care of this. You have to learn just as much as you need. Okay? Let me tell you, God has sent you here for 100 years. Where is my book? Okay? God has sent you here for 100 years. You have come from the universe to live here for 100 years. Okay? And simultaneously, God has sent you 100 years food with you. It's up to you for how many years you use that food. If you manage to use that food for 100 years, you will live for 100 years. If the day you finish that food, you have to go. So, those of you who are a little bit on the fatter side, whatever is left over, try to use it for a longer time. Try to eat lesser and lesser. Have you seen people, how many people you have seen beyond 90 or beyond 100? Out of 100 people that you see, 99 would be just slim and trim like this and would be eating only this much every day. And they are very healthy without any disease. Put this thought into your mind. How are they? Okay? And then you will realize how good, how well you should reach or you should eat. Not just a balance. Balance has to be there. That's why the answer, all of you, very, very, very good. Okay? Perfect. Alright? Now comes a turn of Team C. Ready? You opened your score well. Huh? Good. Your batted, your first batting has been good. Alright? Let's have a question for Team C computer. Our daily requirement of salt is how much? 5 to 6 grams, 10 to 15 grams, 1 to 2 grams, 100 grams per day.
See, meat.
You're playing a test match. Take your own time, but not too much. Good consultation, huh?
Option B.
Option
B.
B. B 10 to 15 grams per day. Are you sure? Okay. Are you sure or you are just fake that? Both of you are sure, okay? Riansi also is so sure that it is 10 to 15 grams per day. Come on, computer, let's block this. Let's block this answer.
B.
10 to 15 grams per day is a wrong answer. Now, anybody in the audience? Okay, let me have the last. So I'm going to go across. Don't worry. Just lift your hand, and then I'll decide.
Hello.
So I think option C 1 to 2 grams.
Option C 1 to 2 grams per day. Okay? Yes. Alright, computer, please block answer C 1 to 2 grams per day. Okay? Some boys right in front here, yeah.
Option A, 5 to 6 grams per day.
Option A 5 to 6 grams per day. You have only two options left now. So 5 to 6 grams per day. Can we have the answer, computer? Yeah, perfectly. Okay. See, we have a lot of wrong thoughts on salt that we should consume. Okay. And you will go to hospitals and you will find a common diagnosis of people who die called hyponatremia, low sodium, and a lot of drugs that we use also produce low sodium. Okay, we have been given a very you mean to say 5 to 6 grams per day is equal to 1 teaspoonful, and if you talk about 10 to 15 grams per day is 3 teaspoonful. That is definitely too much. And 1 to 2 grams per day is not even, it's like saltless food. And many times your doctors tell you, and many times our books have been writing, if you have a blood pressure or a heart problem, take low salt. And then you go ahead and stop salt completely. Let me tell you, sodium is a basic ion of our body. If any cell has to work, so liver cell, take a liver cell, it has got so much of function. So it has to start working. The first thing it has to happen is like your scooter, you need to put a key. Okay, put a key and your scooter starts. The same thing in every cell, sufficient sodium has to come inside the cell for it to start its work. If your sodium is less, let me tell you, the cell will either not function properly or stop functioning, like a heart. If it's a sodium, if it is a cell of the heart battery, it just stops functioning, and as you walk along, you drop down dead. And you have seen so many of such videos, and in many of them, there is just a lack of sodium. Many times you are told you should eat less salt. Absolutely wrong. We have done hell lot of studies on that. There is no reason to say that salt. Finished? Okay. There is no reason to say that less of salt helps your body. Less of salt reduces your blood pressure. No. We all need sufficient salt. And only thing, salt is such a thing, if I make it more, your body cannot accept it. If your food is salty, you will not eat it. So it is auto-regulated by your body. So learn to take sufficient salt, and we have seen with people who take little extra salt live longer than people who take much lesser salt. So take your salt as per your way, as per your taste. Whatever is your taste and whatever salt you need, that is the taste. That is the amount of salt you need. So from today onwards, you can quote my name. Tell them, if anybody doctors tell you we are not going to restrict salt in our diet, I am going to take as much salt as my body needs. And how my body tells me is on my taste. Okay? This is one very, very vital thing. If I tell you today there are 100 people who are dying in Goa, 50 of them would be because of lack of salt. Just because of lack of salt. So this you should not allow it to happen to any one of your relatives. Okay? So let's, now who's left over? What is that?
Rice.
Oh yeah. Come. Give. Who's going to give? Right. Let's come to Team D now. It's your turn now. Yes. You got a very easy one this time. Huh? Last one was tough and you answered it well. This time it's easy one. Hydrophobia is a symptom in dash disease. Rabies, pneumonia, osteomyelitis and typhoid. I hope we all know what are these diseases.
So option A, rabies.
Option A, rabies. What is rabies?
Sir, when you get a bite of a dog who's infected with rabies, you get hydrophobia.
Okay. And what happens if you are suffering from rabies?
Sir, I think it's a viral disease and you start getting hydrophobia and
And what happens to the person who gets it?
The person usually tends to die and
Person, till today, person always dies. Not tends to die, okay? Right, let's take this answer. Answer A, rabies. Perfectly correct answer. Okay, so you get 100 marks for this. Alright, so our first round is over. Is there any, okay, first round is over. Okay, at the end of first round, Team A leaves with 200 marks. Team B, you are yet to score. Team C, you are only with 100 marks. And Team D is equal with 200 marks. Okay? So, good beginning. Test match is going on well. Anything that you wanted to ask me? No. Okay.
Doctor, before you go to the next round, participants, please check your mic. You have to hold the mic very close to your lips.
Say
it is not
say
audible.
loudly,
Just check.
say
Just check.
confidently.
Please check. All of you.
say hello.
Say hello.
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 Yeah, exactly.
Okay?
Huh?
Right?
Hello.
Fine.
Yeah.
Let's go to the second round. Let's see what's the second round. Take your chance and pass on. So you will answer, you'll take your chance, no negative marks. If you are wrong, it will go to the next team, A, B, C, D. Okay? So let's start with team A. X-ray was invented by C.V. Raman, the greatest Indian scientist, William Ranjan, Sir Harvey, or Marie Curie, all absolutely big scientists.
Marie Curie.
Marie Curie. Okay? Answered the, are you sure? Just answered so fast. Are you sure it's Marie Curie? X-ray was invented by Marie Curie. Okay? Come on, computer, block the answer D, Marie Curie. Computer says you are wrong. मेरी नजर लग गई है. Okay. All right. The next team is team B. You have only 3 answers left now. Shravan is not sure. He wants Anisha to say.
Option B, sir.
Option B. William Conrad Ranjan. Do you know? Are you sure?
It's just a guess.
It's just a guess?
Yeah.
Okay. Let's see. Let's accept your guess. Computer. Sanisha is guessing the answer. Correct answer should be B. You're perfectly right. Okay. So you're opening up your mark sheet now. Okay. All right. So if you look at your 7th standard textbook, there's a lesson on X-ray and Ranjan. First they were actually called as Ranjan rays. Okay, and let me tell you, at that time he did not realize the importance of this rays, and he died of cancer due to radiation of X-rays. He started handling these X-rays himself. Okay. All right. So now back again to team B, right? Okay. Now you get 50 marks for this. Okay. So there's one more. See, now second question goes back to them. Okay. Come on now. For CT scanning, we make use of. Here's the CT scanning that we do. What is it that we make use of? Is it magnetic field? Is it X-ray? Is it ultrasound? Or is it infrared rays? I think Sanisha should answer because she's lucky. All my volunteers, please sit down and be relaxed. Just be there for your responsibility. You don't have to stand all the time. All of you don't have to stand. Okay, some of you, yes. Magnetic field, X-ray in CT scan, ultrasound and infrared.
B X-rays.
B X-ray. In CT scan, we make use of B X-rays. Are you sure? More than 50% or less than 50%? Or 50-50?
55.
Come on, computer. Let's accept the answer B X-rays in CT scan. Perfect. Okay. In magnetic field, you use magnets. MRI. Wherein radiation is not serious. In CT scan, you use X-rays. One CT scan is equal to 300 X-ray chests that are done. So when your doctor tells you to go for a CT scan, or when you ask doctor to go for a CT scan, just don't run. Be careful that it has radiation on your body. Okay, any test. Anything in medicine has got good effect as well as side effects. We must think twice before doing anything in medicine, especially the surgery. Okay. We cannot replace what God has created, given us. So when you do any surgery and throw out something from your body, think twice. Okay. In ultrasound, it is ultrasound which is the safest. Ultrasound is sound waves, which is the safest. You can put it on a new 2-year-old baby. Okay? And infrared rays are the heating rays. Are the rays which, if I get a swelling here, I'll put infrared rays and heat it and allow the swelling to go away. Okay? Second thing on ultrasound, let me tell you, there are two, you do sonomammography, you go do mammography. There are two mammography, one which is done by X-ray and one which is done by ultrasound. If your doctor tells you sonography with X-ray, think twice. Okay? Because that X-ray and doing sonography with that X-ray itself has created number of breast cancers. And there are a lot of countries which have banned X-ray mammography. Do only ultrasound mammography, which is called as a sonomammography. Sono for sound. Okay? So you get 100 marks for it. So you are catching up now. Let's come to team C. I think I'm lagging behind the time a little bit. Okay. Let's come to team C. Name the thigh bone. Is it femur? Is it humerus? Is it tibia? Is it fibula?
Option A.
Option A. All right. You don't. Okay. Come on, computer. Team Gautam says option A. Thigh bone. Perfectly right. Okay. All right. And now comes team D. Come on now. Which of these is a female pelvis? These are the pelvic bones. Okay, one is from a male and second is from a female. Which one is a female one?
So option B, pelvis.
Option B. Are you sure?
Yes.
Why do you say option B?
So there's some space for the pregnancy and delivery.
There is a lot of space for the baby to come out. Okay, perfect. Good common sense. Okay, let's block our answer B. Okay, that's perfect. Okay, so we are continuing with round 2. Come on now. It's back to team A. Bone in green color is which bone? Frontal, maxilla, zygomatic or mandible? I think this is a very simple answer, na?
Frontal.
Frontal bone. Are you sure? Absolutely sure? Yes. Computer, come. Let's block frontal bone for team A. Perfect. Maxilla is this bone, zygomatic is this bone, and your mandible is this. Okay? Come on, now let's go to team B. Team B, na? Ready? How does exercise help people with diabetes? Okay? If you have somebody in diabetes, every doctor will be telling that person, please exercise, please exercise. What does it do? Number 1, it improves oxygen flow. Number 2, it lowers insulin resistance. Cause of diabetes today is insulin resistance. Okay, it regulates blood pressure, or all of the above.
D, all of the above.
D, all of the above. I could see both of you looking at that because it's more prominently given. Okay, all right. Let's see. The computer, block the answer. D. You are perfect. Friends, everybody has people with diabetes in the house. Only reason why you get diabetes is erratic diet, develop your paunch, and no exercise. And if you go back to this, you can throw your diabetes out. Just these two. I know diabetes, we make such a huge, the whole world talks about something or the other every now and then about diabetes. But just these two, control your diet, as we saw in the beginning, and increase your exercise, and you can throw diabetes out. Second thing, if you look at this, it lowers insulin resistance. Diabetes of elderly is type 2 diabetes. Okay? And the cause for this type 2 diabetes is insulin resistance. And many times your doctor gives you insulin for type 2 diabetes. Will it act? You have diabetes because your insulin is not responding, it is resistant to its effect. So in type 2 diabetes, first line of treatment is medicine, is your diet, is your exercise, and third is medicine tablet, not insulin. Okay, because you're already resistant to insulin, you already have a very high level of insulin in your body, and then you add insulin to it, it does not act. It in fact leads to more and more complication. Okay? Now we finished with team B. It's your turn now. Yes? Team C, na? Team C, come on now. Your question is already here. It has found that we have dash vitamin deficiency in India due to our sedentary lifestyle. Which of these? Vitamin D, vitamin K, vitamin B complex, or vitamin E? Allow Riyansi to answer this time. She has not answered. Huh? She's fully pushing it on to Gautam, and if he goes wrong, she'll say, "Oh, Gautam, you went wrong." No? Okay. I know you coordinate very well. Surprisingly, you agree with every answer that you want to give. Yes.
Vitamin A.
Vitamin A.
E.
Okay. You want it? You want me to lock it? Yes, computer. Please lock answer vitamin E for team C. Okay. Now, team C, team D. You have a chance to score another 50 marks more.
Option A, vitamin D.
Option A, vitamin D. Okay, shall we lock it? Yes. See, let me tell you one thing here. We are all deficient in vitamin D because we do not go out into sunlight. No food has vitamin D in it. Vitamin D comes to us only through sunlight. And you know how much time it takes for you to get your 2000 units of vitamin D in for a day? You have to sit in sunlight for 3 hours between 11 to 3. Not on early morning sunlight. Okay? And that too without your clothes. Only then you will manage to get your full dose of vitamin D. And lack of vitamin D leads to all your bones getting porous. Lack of vitamin D it also contributes to a heart attack. It also contributes to stroke, and it also contributes to cancers. So we must have vitamin D in our body. And I would say go ahead and go to your doctors and tell doctors to give you a vitamin C tablet. Fortunately, we have created that vitamin D in a tablet today. Just take a tablet and you will get your dose of vitamin D. Okay? Yes. Now, you are getting a new question now for you. Okay? Deficiency of iodine leads to what?
Option A, goiter.
Option A, goiter. Okay? Computer, log the answer for us. Option A, goiter. Wow, that's great. Okay? So I think there we finished the second round. All right. At the end of second round, what happens? Score. This is okay.
Team A, 300 points. Team B, 250. Team C, 200. And Team D, 450
Wow.
points.
You are leading now. Okay, let's go to the third round now. I am the doctor. Now, when you answer this question, believe that you are already a doctor. Okay? I know you will find it difficult. Okay? Alright? And then let's have this question. Let's start with Team A. This is a diabetic foot. It's a person who has a long-standing diabetes and he has developed a wound and the wound is not healing. That is the time we call it as a diabetic foot. This is a diabetic foot. If not treated, it may lead to what? Amputation, that is cutting of the leg, or gangrene of the leg, or death of the patient, and all of the above. Which is your correct answer? Option D, all of the above. Are you sure? Okay, so sure. Very good. Siddhi is so confident, huh? Come on, computer. Let's see how right is Siddhi. Okay. Remember, if you are diabetic and even if you have one little sore on your leg, first thing that happens is you do not feel the pain because the pain nerves are dead. So you don't even know what happens. So if you have diabetes, first thing you should do is take a bucket of hot water, put your own hands inside and clean your legs, feet before you go to sleep. You never know if there is a small pin which is attached there, you don't get the pain and you subsequently lead to a situation like this. So if it is much, it can become a gangrene there and then you have to lose your leg, and if this is also not done in time, you will lose your life. Because once that infection goes inside your body, you have no resistance to fight it out. Okay? So she's perfectly right when she says it can lead to any one of these. Okay? Now let's come to Team B. Okay? Shravan and Sanisha, you have to bug up. Okay? Maintaining our respiration with the help of respiratory center is the responsibility of
Medulla oblongata.
medulla oblongata. You are so quick, very good. And you will also help me with to save my time because I have a definite time. Na? We have to finish at before 4 o'clock. Okay, lock it up. Perfect. Absolutely. Okay. I don't think I need any explanation onto this because this answer came that quickly. Come on now, let's go to Team C. Alright, be careful now. Huh? Speckle tracking is a very advanced recent technique developed in the dash branch of medicine. Is it ECG? Is it CT scan? Is it PET scan? Is it echo? Okay, you want to play slowly. I think I'm going to go to sleep.
Eco.
Echo. Alright, what is echo stands for?
Just a guess.
Just a guess. Okay. Alright, computer. Let's see how Gautam's guess is correct. Okay? What does ECG show? No, the problem is here. Okay? That's what my mic. Okay? ECG just shows an electrical activity of the heart. It's one of the function of the heart. Heart has three muscles: pericardium, myocardium, endocardium. And it has 4 chambers and 4 valves. It cannot show anything else. And on top of it, you have this electrical connection in this room. The same way that the ECG shows you only how well is the electrical connection of the heart. From there, we derive what is the condition of the heart. CT scan, you know, it's a big machine. PET scan is another a big machine. And echo is echocardiogram. In echo, what you do is you pass your sound waves, look at your heart completely, see the pericardium, see the myocardium, see the endocardium, see all chambers, see everything inside your heart, including the blood supply to your heart. So one message, keep it in your mind. If your doctor tells you, come, let's go for angiography, please ask your doctor to get a proper echocardiogram done and see your heart nicely. And it's so simple and so safe because it's ultrasound. Just you pass ultrasound and you can see it very well. Of course, it needs a little expertise on the doctor's side. Many of the doctors do not know, and then what he does is straightway sends you to angiography, bypassing the basic way of doing it. Okay?
Excuse me, doctor. Let's welcome our chief guest of this function, Honorable MP Saravanship Tanode. Sir, please.
Welcome, sir. Welcome so much. Okay? All right. We are exactly in the middle. Let me complete this round. Huh?
Yeah.
Okay. Then I. Okay. Where are we now? Team C has given a correct answer to us, and then we are coming back to Team D. Okay, you are playing very well. Yes, Sanvina. Okay, this is the answer? No. This is your question? You are also lucky. Yeah? I made your answer very easy for you. Okay, echocardiogram is used to assess the following functions of the heart: valves, muscle, coronary artery blockage, all of the above.
So option D, all of the above.
You answered, you're absolutely lucky like you. All right, now I'll stop talking too much. Okay, yes. Are we finishing with round 3? One more. We are going to the next. We are back to Team A. My grandmother has arthritis. She regularly goes to a dash for her treatment. Is it an oncologist? Is it a rheumatologist? Is it a radiologist or a venereologist?
Second.
Rheumatologist? Second or B?
Second or B?
B. Okay. All right. Are you sure it's rheumatologist? Who's a rheumatologist? Okay. Shall we lock the answer? Computer, please lock our answer. Rheumatologist. Absolutely right. Now, who's a rheumatologist? Good speculation. That's why I said you are lucky. You are well blessed today. Okay? Rheumatologist is the person who deals with a disease called rheumatism, wherein you get joint pains and you get many more complications. You begin with joint pains, you end up with kidney failure. Okay? So that's your answer. All right. Let's come to team B. And okay, the doctor working in this room will be in this room. Huh? Who's working in this room is called as otolaryngologist, radiologist. Please listen to read them properly. Okay. I don't have ordinary answer. I've told you this time it's one of the toughest thing to you. Physician or a surgeon?
B. Radiologist.
Be a radiologist. Are you sure? Will lock the answer? Yes. Perfect. Okay. I don't think we need any more answers or explanation onto that. Gautam, ready? Riyansi? Yes, for your answer, for your question. Ravindra sweats heavily every day. He must be losing dash through his sweat. NaCl, urea, lactic acid, all of the above. Please, I can hear some sounds from the audience, okay? You will lose that chance also, na? Both of them work like good consultants. Huh? Very good. I'm happy that a boy and a girl accept a few things, okay? Usually, girls will never accept what boys tell you. Huh?
All of the above.
All of the above. Are you sure? It's a very, very tough question. What is NaCl? Okay, we'll not come to that. Let's see whether this is right or wrong. Okay, you want to change? You still have a chance. No? Very good. Are you confident? So confident. Okay, come on computer. Please lock us the answer D. All of the above. Perfect answer. Okay. What is NaCl? Your salt. Second is urea. Urea is another toxin in the blood when your kidney fails. And lactic acid is you have a body, as you have heard about acid, alkaline, and neutral. Okay, this lactic acid it rises in the body when our body becomes acidic. Okay, and that extra acid will all be thrown through the kidney. So a normal healthy kidney is a must for all of us to live a healthy life. Okay. All right. So let's come to team D now. All right. Wow, you got a very simple question. We are still lucky, huh? Your blessings are on. Species of Plasmodium which causes cerebral malaria is which one? And I said very simple question.
So option B, falciparum.
Option B, falciparum. Okay. Sure?
So it's a guess.
Just a guess. Let's see whether it's a good guess or a bad guess. Huh? Come on, computer, please lock us the answer falciparum. So we have all 4 types of malaria in Goa, and the commonest of them is vivax and falciparum. Vivax gives you usually a very simple malarial infection, but falciparum malarial infection is a very serious infection which can put you into coma, destroy your liver, and can give you cerebral malaria. Once you get a cerebral malaria, you have a chance of even dying. So all those people who you might have heard have died because of malaria will be having falciparum malaria, and in Goa we have both these malarias. So if you have a malaria, be careful. Okay? So round 3 is over. Alright? 1 round, 3 rounds are over. Now I can take a break. Okay, sir? I know you need to.
Yeah.
You need to go. Okay? I'll ask Vash to take over from me. We'll have a small
Hello.
break. Okay?
Yeah.
If you want to take off, you can.
No, let them sit. No.
Okay. No, if they want to, if anybody want to go and come back.
Okay. Since our chief guest is a little busy for some other program, he has to attend another program. We'll have a small program, and that is a releasing of new book which is written by Dr. Digambar Naik. This is something new coming to you, and it will be there on the counter. May I now request Dr. Digambar Naik to please welcome the chief guest of today's program on the days. I also request Dr. Shalak, please, Dr. Pratnya, to please join me on the days. And of course, Madam, you may please come on the days. Mangala, yes. It's privilege to my friend who is a chairman of cultural cell of BJP, Advocate Deepak Tirve, to please introduce the chief guest of today's function.
Thank you, Swash, for the privilege. Dear friends, we have amongst us a well-known personality as a chief guest. You all are aware, you all know him. He is a vibrant personality in Goan politics. Coming to his qualification, coming to his business and everything, he has involved in educational field. He is also the chairman, and he's also the member of schools. He has got biodata which will take about half an hour it will take. So I will just point out very major post what he is holding. He has been a very active in BJP. He has been a founder member of BJP. He is actively involved in Bharatiya Janata Party. He has served as the secretary of Bharatiya Janata Party for several times. Thereafter, presently he is the president of Bharatiya Janata Party, Goa Pradesh. As far as political position, what he has had, he was elected as a Panch, Sarpanch and Deputy Sarpanch from his village, and he won for 4 consecutive terms in the Panchayat election. Thereafter, he climbed his ladder and he contested from the constituency, Thivim constituency, and he won as assembly. He was given the privilege to represent the people of Thivim constituency to the assembly, Goa Assembly. Thereafter, he has also held chairman of Goa Tourism Development Corporation. He has also been a chairman of Economic Development Corporation, Government of Goa. Regarding social activities, he is a member of Pirna Gram Seva Mandal. He was the secretary of Pirna Gram Seva Mandal. Then Sri Shantadurga Vidyalaya, Sri Shantadurga Higher Secondary School, Pirna. Thereafter, he was the chairman of Pirna Gram Seva Mandals. Then, in 1999 till date, he is the director of the Jana Utkarsh Urban Cooperative Credit Society. Then he has special interest in reading and sports. He loves sports and also reading. He has been active. He is also outside Goa. He has got connection with the BJP and work done in Khanapur constituency, then Kankavali constituency, Sawanpadi constituency. You are all aware that now he is a member of Parliament, Rajya Sabha, presenting before you our beloved president of Bharatiya Janata Party, who has brought the Bharatiya Janata Party at a very highest level in Goa. Presenting to you Honorable Member of Parliament, Sri Sadanand Seth Tanawade.
Thank you, Deepak. And now I request Mangala Madam to please hand over the bouquet. Let's welcome our chief guest with bouquet of flowers. As I said that we will give a little task to the chief guest to release the new book which is written by Dr. Digambar Naik. Book number 8. May I request Dr. Pratnya, who has really worked on this book, to please pass it on to the chief guest for releasing it.
मी लागी दोतर तुम्ही असे दोतर तुम्ही असे
Thank you. This is a new eighth edition of eighth new book, I think, of Dr. Digambar Naik, that is Wisdom of Health, which is written by Dr. Digambar Naik. It will be now available. If you want to buy, it will be at a very concessional rate at the counter. We have kept this book. While going, you can go through it. If you want to buy, you can buy it also. Okay, thank you very much. At this juncture, I will request the chief guest to please say something on this occasion.
Thank you so much. All Goa quiz competition ज्यांना ऑर्गनायज केलें ते गेली 15 वर्सां आमचे डॉक्टर दिगंबर नायक वृंदावन नर्सिंग इन्स्टिट्यूट ऑफ वृंदावन नर्सिंग इन्स्टिट्यूट गोवा आमचे रोटरी क्लब तशेंच आमचे रेड क्रॉस सोसायटी आनी खास करून हाका मुद्दम म्हाका हांगा आपयलो हांव पयलीं म्हळ्यार आमचे दोतोराचे धन्यवाद दिता आनी तशेंच सुभाषाक सुभाष फाटल्यान लागिल्लो येवं जाय म्हणून आज एकाच वेळाचेर 2-3 कडेन कार्यक्रम घेतिल्ले आनी त्या म्हाका पयलीं कळ्ळें की हांवें हांगा 5:30 येवप म्हणून पूण मागीर लक्षांत आयलें की हांगा सुभाषचें म्हणलें की भुरगीं पयसच्यान आयले आनी म्हणलें हांव बेगीन येवन वता म्हणून आज हांगा आमचे बरोबर आमचे दिगंबर बाब नायक आसात आमची तेंची घरकान्न आमचे तांचे पूत दोतोर तांची सून म्हजे मित्र सुभाष बाब एडवोकेट तिलवे वेगवेगळ्या स्कुलांतले जे आज क्विज कॉम्पिटिशनान भागीदार आसात ते सगळे स्टुडंट्स पत्रकार आनी खास करून हांगा उपस्थित सगळ्या भावांनी भयणांनो सगळ्यान पयलीं हांव दोतोराचें अभिनंदन करता कारण गेले 15 इयर्स ते एक विशय हो सगळो मेडिसनांतल्या संदर्भांतलो विशय घेवन ते भुरग्यांक क्विज कॉम्पिटिशनां हांगा ऑर्गनायज करता आनी सुभाष हे सदोदीत ह्या कामाक तांचे बरोबर आसतात गेल्या वेळारूय हांव आयिल्लो हांवें तुका सुभाषाक विचारलें भुरगीं कमी कशी काय म्हण गेल्या वेळार हांवें मिनेजीस भागान जावला म्हाका दिसता 500 भुरगीं तरी आसतलीं फूल गोंयची आनी एक बरो विशय बरो सब्जेक्ट आनी त्यामुळे त्या विशयाचेर भुरगे ज्या तरेन हांगा आन्सर कारण भुरगीं कितें सायन्स फिल्डांतलीं आसा अशें ना वेगवेगळ्या हातूंतलीं आसात पण नॉलेज जी आसा ही नॉलेज अपग्रेड करपाक मेळटात आनी त्यामुळे दोतोर स्वता इंट्रस्ट घेवन कारण आपलो इतले व्यस्त वेव्हार आसून सुद्दां म्हणजे तांचें प्रोफेशन हें व्यस्त तरी पण एक हाचो फायदो आपण जे कितें शिकला ताचो फायदो भुरग्यांक जावचो ह्या समाजाक जावचो आनी म्हणून तांची सदोदीत धडपड आसता आनी बऱ्या तरेन दोतोरा कडेन वयतकच मनीस अर्दो बरो जाता की दोतोरान बऱ्या तरेन सांगतकच आनी दोतोर दिगंबर ह्या संदर्भात ज्या तरेन तेंचें उलोवप आसता तें जर पळयलें आसत जाल्यार एक बऱ्या तरेन वेवस्थीत त्या पेशंटाक सांगप आनी म्हाका याद जाता कारण वृंदावन हॉस्पिटल जेन्ना तांचें हांगा आशिल्लें पेड्यान आनी म्हजो भावजीक रातचो अटॅक येल्लो आनी तांचे कडेन हांवें त्यामुळे इमिजिएटली फोन करतकच दोतोर इमिजिएटली थंय पावले 4-5 आनी ते इतल्या थंडपणान सांगलें आनी तेन्ना गोवा मेडिकल कॉलेजान ती हाची फेसिलिटी नासतली एंजिओप्लास्टी मागीर तेंच्यांनी म्हणलें की अपोलो हॉस्पिटलांत व्हरपाक जाय पूण ज्या तरेन म्हणजे तो पेशंट अर्दो बरो जाता भितरल्यान सांगपाची जी पद्दत तेंची आसताली आनी हें सगळें आसून तांच्यांनी म्हाका आतां दोतोर म्हणलें की 8वो बूक हांव खूब म्हजे भाग्य समजता की म्हजे हस्ते कारण हांव इतलो भाग्यवान की म्हाका तेंच्या पुस्तकाचें हें म्हजे हस्ते विमोचन करपाक मेळटा आनी ताचे भितर तांच्यांनी जें बरयलां विजडम ऑफ हेल्थ म्हणजे हेल्थाच्या संदर्भात हांवें पळोवना ते पण बरेच कांय गोश्टी केअर घेवपा सारके आसतले कारण हें एक उदाहरण तांचें आसता म्हणजे स्वता दोतोराक कोणी 25 वर्सां पळयला आसत जाल्यार आतां दोतोर आसा तसोच आसा आमच्या भितर बदल जाता आमचे मातशें फुडें येता पूण दोतोर आसा तसोच आसा कारण एक तें हाचें एक वेगळेपण तांचें आनी त्यामुळे एक जे आपल्याक जें कितें समजता ते लोकांनी तें आत्मसात करचें ताचो लोकांक ताचो फायदो जावचो हे सदोदीत तेंचें तंतोतंत जें आसा हें सदोदीत तांचें आसता कारण ज्यांच्यांनी गांवांतल्यान आपलो कॅरियर उबो केलो म्हणजे नेरूल सारके नेरूल की वेरें न्ही दोतोर त्या भागांतल्यान एक नामवंत अशें दोतोर गोवा मेडिकल कॉलेजान जालें स्वताचें एक वेगळें अशें नांव तेंच्यांनी ह्या गोंयभर दवरलें आनी खास करून बार्देस तालुका आसत तिसवाडी सगळ्या भितर पूर्ण गोंयभर आनी हें करता आसतना एक मनीस जोडलें म्हणजे आपलो सगळो हे असून सुद्धा वेगवेगळ्या सोशल जे ऍक्टिव्हिटीज असतात, मागीर रोटरी क्लब असत, लायन्स असत, मागीर रेड क्रॉस सोसायटी असत, ज्या माध्यमांतल्यान समाज सेवा आपल्याक कशी करपाक मेळटली. म्हणजे सगळीच कडेन पयशे मेळटले अशें ना. आज क्विज कॉम्पिटिशन घेतकच घरची पूर्ण मंडळी त्यांच्या हांगा तांच्या बरोबर आसा आणि हे करतकच आपलें प्रोफेशन सायडीक दवरून थंय जर बसल्यार म्हाका दिसता गल्लो आनी सुबेस येवपाचो, पण तो सायडीक दवरून तेची नॉलेज भुरग्यांक शेअर करप. म्हणून तांचे म्हाकाय दिसता की भुरग्यांक खरें म्हणत जाल्यार स्कुलांनी सांगतकच धाडपाक जाय, तातूंतल्यान भुरग्यांची नॉलेज वाडटा आणि एक फ्री ऑफ कॉस्ट, म्हणजे कांयच ना, सगळे हांगा येवप आनी फक्त तातूंतल्यान विविध विशय जे आसा म्हणजे मेडिसिनाच्या संदर्भातले ते विशयांचेर ते स्वता कोणाक तरी दुसऱ्याक सांगता अशें न्ही, स्वता एक्सप्लेन करतात. आणि क्विज कॉम्पिटिशन हांवें खूब पळयल्या, पण हे क्विज कॉम्पिटिशनाचे आन्सर दिल्या नंतर त्याचे एक्सप्लेनेशन दिवप हे सगळ्यांत खास त्यांचे वैशिष्ट्य. म्हणजे ते प्रत्येक गोष्टीचे आन्सर दितात, कारण एखाद्या भुरग्यान अंदाजान एखादें उत्तर दिता आसतलीं भुरगीं, पण ते अंदाजान दितकच तें खरें कशें हें सुद्धा तांकां ते सांगतात, पटोवन दितात. हे सगळ्यांत महत्वाचें. म्हणजे एखाद्याक सायन्स शिकनासतना सुद्धा त्यातले कांय गोष्टी तेंचे कडल्यान शिकूंक मेळटात आणि म्हणून हांव परत एकदा दोतोराचें अभिनंदन करता. तांच्यांनी अशा पद्दतीचे कार्यक्रम हे अशेच फुडें दवरचे आणि त्यामुळे गोंयच्या सगळ्या विद्यार्थ्यांनी म्हाका दिसता ज्या ज्या स्कुलान ते धाडटात तांच्यांनी खरें म्हणत जाल्यार येवूं जाय. आणि सुभाष हे सदोदीत दोतोरा बरोबर प्रत्येक गोष्टीक आसतात म्हाका दिसता. आनी त्यामुळे सुभाषाचें अभिनंदन करता, दोतोराच्या घरकान्नीचें. आणि दोतोराक बूक बरयतकच ते कोणे तरी कोऑर्डिनेट करून फुडें वचचो पडटा. त्यामुळे दोतोराची सून तिचें योगदान हाचे बरोबर आसा. त्यामुळे तिचें अभिनंदन, दोतोराच्या पुताचें अभिनंदन करता आणि देवा कडेन मागता की दोतोराक एक बरें हेल्थ आरोग्य तांचें दवरचें, जेणे करून समाजाक लागून तांचें अशेंच योगदान अशें हाच्या फुडें उरचें. इतलें सांगता आनी म्हाका मुद्दम आपयलो आनी दोतोराचो अर्दो कार्यक्रम करून म्हाका मदींच उलोवपाक दिलो. सुभाषाकूय धन्यवाद दिता आनी हांव म्हजें भाशण सोंपयतां. धन्यवाद. देव बरें.
मुद्दम सांगूचे दिसता. गेल्या वर्षी आता तुमकां सांगला सरान की गेल्या वर्सा सर आमच्या वांगडा कार्यक्रमान आसले चीफ गेस्ट म्हणून मिनेजीस ब्रगांजान. हॉल पॅक आसलो. ऑफकोर्स सरान बरोबर नोट केलं. म्हाका आयल्या प्रश्न केलो, सुभाष भुरगीं कमी दिसता मरे. येस, वी हॅव टेकन अटमोस्ट केअर. गोंयच्या सगळ्या कानाकोपऱ्यांतल्या हायर सेकंडरीक आमी सगळ्यांक ईमेल इन टायम धाडला. रिमाइंडर रामेश्वरी आनी ताचो स्टाफ. त्या भायर हांवेंय कितकेशेच प्रिन्सिपलांक फोन करून सांगले, सर प्लीज मॅडम प्लीज धाडा भुरग्यांक. कारण कशें आसा, फक्त प्रायज गावतले म्हणून धाडपाचें ना. एज सर सेड, कितकीशीच नॉलेज आयज खंयच्याय दोतोरा कडेन गेलो तर अशी नॉलेज बसून कोण कोणाक फुकट दिना. बट डॉक्टर नेवर माइंड्स फॉर दॅट. डॉक्टर इज व्हेरी मच सो मच एक्सायटेड टू पास ऑन दीस नॉलेज. आणि गेल्या वर्साच जेन्ना चीफ गेस्ट म्हणून जेन्ना सर आयले आमच्या कार्यक्रमाक, फक्त अर्दे वर बसले. म्हाका आमी जेन्ना च्या पिवपाक बसले तेन्ना सुभाष पयलीं सांगलें जाल्यार आपूण आनी एक वर करपाचो मरे. कितकी नॉलेज गावता मरे ह्या प्रोग्रामांसून. आनी असो प्रोग्राम गोंयांत तुमी फक्त इल्ल्याच्या लेवलाचेर व्हरू नाका, व्हडल्या पावंड्याचेर वचपाक जाय अशे शब्द तेंच्यांनी आमकां सांगले. आमकां सारकें लक्षांत आसा. म्हणून डॉक्टर म्हणपाक लागलो की अवनूय बी आमी आपोवया चीफ गेस्ट म्हणून सरान. कित्याक तर तेंचे मार्गदर्शनाचेर वचचें म्हणून. सर, वी आर ट्रायिंग आवर बेस्ट. इट्स आवर बॅड लक दॅट व्हेरी फ्यू हाय सेकंडरीज हॅव टर्न अप टुडे. एनिवे, वी थिंक दॅट एटलीस्ट तुमी जी आयल्या ती तुमकां सगळ्यांक बऱ्यापैकी दोतोरा कडसून नॉलेज गावता. तशें सांगलें पळय, उत्तरूच दिल्यार जायना, ताचें एक्सप्लेनेशन करप हें सुद्दां खूब महत्वाचें आसता. रायट सर, थँक्यू व्हेरी मच. वेळान वेळ तुमी काडून आयले म्हणून, कारण फुडलो कार्यक्रम तुमकां आसा आमकां खबर आसा. बिफोर वी लीव फ्रॉम दीस stage, I will request the Dr. Digambar Naik to please present a memento to our chief guest. Yes, this is to our chief guest. Thank you very much. I now request all of you to please take your seat and Dr. Digambar Naik to carry on.
Thank you so much.
You can carry on next round.
Okay, we are back now. Now we are more relaxed. So where are we now? We have finished 3 rounds. Okay. I think I have time. Okay. Now we are going into the 4th round. Okay. 4th round is my carrier. What is my carrier? This is for you to think whatever carrier you have chosen is the right carrier for you or no. And then rethink. Of course, you have still a long time to go. Okay. So let's come to the round number 4 now. Come on now. Come on, everybody, relax. Okay? Computer, please. Let's go with team A now. Okay? What is this help it calls? Seema went to a doctor as she was finding it difficult to pass urine. It was burning during urination. This is known as anuria, polyuria, dysuria, or oligouria. I think this is a very simple question. If you are taking time, I would enjoy sitting, but every time I sit here, the mics give me problem.
So option A, anuria.
Option A, anuria. Okay, are you sure? Not sure. You want to change? You are now into one-day cricket. Huh? Our test match is over. Now we are moving quickly. Okay? Should we lock? Computer, please lock answer anuria A2 for team A. Not good, okay? Now this, what happens to this question? It goes to the audience? Yes, it goes to the audience. Yes, anybody in the audience? 1, 2, 3, 4, 5. Okay, let me come on this side. Come on, let's see your answer. First, give your name.
Ruchita.
From where? Which college?
Damodar.
Okay. So you are coming all the way from Margam.
Gudi Paroda. Damodar Gudi Paroda.
Paroda. Wow. Very good. Okay.
Option C.
Option C. What do you call it?
Dysuria.
Dysuria. What do you mean by the meaning dysuria?
Painful.
Painful. Okay. Very good. Should we lock that answer? Good. Absolutely correct answer. Okay. Come Rameshwari, give her the prize. Okay. What is dysuria? Many of you must be having this problem, okay? You don't drink sufficient water for some day and then your urine you start getting problem in passing urine, okay? So, anuria is no, you don't pass urine at all. Polyuria is you pass too much of urine. Dysuria is what it is, okay? You have pain in passing urine, you have difficulty in passing urine, you are not happy in passing urine and you pass urine frequently. Okay, especially the girls. You come home, you come in your college, for hours you don't go to your bathroom or you feel your bathrooms are not very healthy and you don't go there and you end up with complaints, with problems, okay? Please make it a habit. Every 3 hours you must go to the washroom and drink sufficient water that makes you go to the bathroom every 3 hours. If you don't have a good bathroom, find one. Okay? But don't keep that urine stored inside. And don't drink less water because you don't have a bathroom. Very, very vital. This little complaint is a result of a number of kidney failures. Please do not, keep this in your mind for the rest of your life. Okay? Let's come to team B. Kidneys do not play a significant role in the removal of what? CO2, water, urea or uric acid. What happened? You become so sluggish. Okay, I like that smile, Sanisha. Along with when you smile, Shravan also smiles. Okay.
Option A, CO2.
Option A, CO2. What is CO2?
Carbon dioxide.
Carbon dioxide. Anything else it stands for CO2?
No.
No. Okay, wow. You're so confident, huh? Alright, computer. Let's have the answer CO2. Beautiful. Okay. You score all 100 marks for that. Okay. What kidneys will always regulate your water. If you drink more water, you will pass more urine. If you drink less water, you will pass less urine. And in mic is not good. Hello. 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 Which one is better? Second one?
Hello. Hello. Check. Hello.
Hello. Okay. Am I better? Okay, come on now. Okay. So uric acid is another impurity which is thrown out through the kidney, and CO2 is thrown out through lungs. Okay. All right. Now let's come to team C. Come on now. Gautam and Yancy. Which of the blood cells have 5-lobed nucleus? Is it erythrocytes? Is it eosinophils? Is it basophils or neutrophil? I'm sure you are seeing these pictures of all these blood cells every day. At least in your book it is there. Okay? I am appreciating your confidence in talking to each other. Cooperation. Five-lobed nucleus. You have drawn this in your book. People in audience are ready, huh? Don't give them a chance.
Option B.
Option B, eosinophils. Is it right? Are you confident? Yes, wow, both of you are so confident. Option B, right? Come on, computer. Both are so confident. It should be option B, eosinophils. No, Gautam. You are not right here. So, the audience, 1, 2, 3, 4. Okay? Audience, last time we gave a chance to a boy. And the last girl, yes. Come. Yeah. Give your name, your college name, and give your answer.
My name is Visha Mule from DPR Higher Secondary School.
Okay.
And option D.
Option D. Neutrophils. Okay. Come on, the computer. Should we lock it? Yes. I won't give you a chance a second time. Absolutely right. Come on, come on. Deepak, give her an audience prize. Yeah. Okay, out of all these cells, this is your neat question. Huh? Your erythrocyte has no nucleus, right? Okay, eosinophils have 2 nuclei usually, at the most 3. And your basophil, usually 1 nucleus. And neutrophils are the one who have 2, 3, 4, 5 nuclei. More than 1 nuclei, even up to 5 nuclei. It is not that every neutrophil has got 5 nuclei. It can get up to 5 nuclei. Okay, so in this answer, that's the correct answer. Okay, now from C, from D, ready? They're always ready. Okay, come on now. Blood vessels that contain valves are called as capillaries, veins, arteries, hepatitis C. Option B, veins. Okay, which veins have valves? Okay, we'll lock this answer. Come on, computer, lock answer veins. Okay. So your leg veins. So when you are standing, the blood is being pulled. There is no pressure in the vein like your artery. When the heart contracts, it pushes the blood. Here the blood needs to be sucked. And this is where your veins have valves. Once it is pushed up, it does not go behind. And when these valves fail, what happens? When these valves fail, you get varicose veins, big veins which are there. Okay? So that's the correct answer. Now let's go to Team A back again. Right? Okay, we are still on round 4. Dr. Dash is famous for performing the first heart transplant. He wants me to sit, huh?
C.
C. Christian Bernard. Right? Are you sure? Not sure. Why not the rest? Why not William Harvey? Okay? Should we lock answer C? Come on, computer, please lock answer C. Perfect. Alright, it was Christian Bernard who was the first one to perform. Your Harvey is more famous for blood circulation, nah? No? Oh, these are all your neat questions, huh? You better understand the history of medicine. Okay? Come on now. Team B, all ready. Commonest causes of aortic valve disease. This is your, on an echo, this is your heart, left atrium, and this is your aortic, the aorta, aortic valve. This is your mitral valve here. This is your left ventricle, and this is interventricular septum and all that thing. You can see so many things on an echo. Commonest cause of aortic valve stenosis. This is, I know this is not a simple answer, okay?
So can I ask for a hint?
Can you ask for a hint, okay? You can ask, I don't, I'm going to answer.
So is it related to something but plague or
No. Valve stenosis is a very common thing which is known today, for which lot of people undergo surgery by replacement of that valve. Now there are 4 valves in your heart: aortic valve, the mitral valve, tricuspid valve and pulmonary valve. Okay? Out of these, there are many causes for this obstruction. Now for this, our commonest cause for aortic valve stenosis means the valve has become smaller. Okay? This much I can give you.
option A.
Atherosclerotic. What is atherosclerosis? Yeah.
I'm not sure, but something related to the blood vessels.
Okay. All right. So you want to block this? Yes, computer. For Sanisha, please block atherosclerosis. Perfectly answered. Now, what is atherosclerosis? As we grow, the calcium gets deposited in the arteries, and so many other things can get deposited into the artery, and leading to blockages. The first place where they get deposited is this valve, and that is aortic valve. If it was mitral valve, commonest cause is rheumatic fever. What is rheumatic fever? You get a little throat infection, you get fever, and you end up in the next 6 months with a blockage of mitral valve, commonest. And the autoimmune, any disease. What is autoimmune disease? Any chronic inflammation in the body subsides, but the body reacts to it. If you have not prepared your body properly to take care of that inflammation, body reacts to it and gives you this autoimmune disease. And half of the diseases today that you get are autoimmune disease. And one of the commonest cause of traumatic is trauma by accident. Commonest cause of autoimmunity. I just said half of the diseases that you get are autoimmune disease. And the commonest, why autoimmune disease? What? Here is one bug which is giving you an infection. Somehow you have responded to that infection. You have killed that bug and thrown it out. But during that process, you need to stabilize your body for that inflammation. When that is not stabilized properly, you have a second process. And that process is called autoimmunity. Like you have a throat infection, the throat infection gets cured, but you have not responded well to it. Your body starts creating antibodies or antibodies against that, and then you have a valve which is getting damaged. And the commonest cause of this process of autoimmunity is, number 1, being jealous, being angry, being hateful. Now, all these reactions help you to create that autoimmune process against your own body. And this is how half of our diseases are just induced by we ourselves. That's why I said your life depends upon, or your health depends upon, number 1 is what you eat. So you are exactly what you eat. Understand this properly. You are exactly what you exercise. And you are exactly what you think. It is your mind which gives you all these diseases which are not existing. You create your own diseases. And your cancer is a disease created by you. There is no cause for cancer. Only cause for cancer is you yourself. This is where this book stands. Wisdom of health. why do you get all these diseases? Okay? Come on. The next, what is our next? Team C. Yes. I'm going to sit before you make me sit. And now my mic is also allowing me to sit. Bicuspid valve in human heart is called eustachian valve, pulmonary valve, ventricular valve, or mitral valve. This is your 10th standard anatomy. I enjoy your discussion, you know.
Option C.
Option C, ventricular valve. Okay? Alright? Computer, let's have the answer sealed up for ventricular valve. Anybody from the audience? Lot more hands. Okay? Let's go to the last time girl, let's go to boy now, na? Let me be fair to all of you.
Option B, pulmonary valve.
Option B, pulmonary valve. Okay? Alright? Computer, let's select pulmonary valve for us. No, now I have to go on this side. Okay? Come. Now we have only two choices. So simple. Yes or no? Yes. Come on, mic for him.
Option D.
Option D. Option D, let's have it locked. Perfectly, that's your answer. Come. Now, what is eustachian valve? Yes? Yes. Okay. What is the pulmonary valve? How many leaflets it has? It is 3 leaflet valve, like aorta. Okay. And what is ventricular valve? Where is it? You said it, ventricular valve. Where is it? There is no ventricular valve in your whole body. Okay. And of course, mitral valve is a valve between. Come on. Who's it? Subhash? Okay. Now we where are we now? Who's the next? Team D. Okay. What is the full form of MRI? We have talked so much about MRI. What is the full form?
Option A, magnetic resonance imaging.
Magnetic resonance imaging. Okay. Are you sure? Oh, very confident. Okay. Disha is very confident of the answer. Let's see now what your computer says to you. A is her answer. Perfect. Okay. Magnetic resonance imaging. Okay. Now, have we finished with round 4 now? Can we have total answers for all of them?
Team A, is scoring 600 points.
Very good.
Team B is scoring 650 points.
Okay.
Team C is scoring 400 points.
Perfect.
And Team D is scoring 850 points.
Very good. Okay. We are still in. We have not reached 2020 cricket now. Okay. Come on. Let's go to the next round. That round is round 5th. Subhash, how much time you are giving me? Half an hour? A little more?
Yeah.
Okay. Let's move a little faster.
We'll go faster.
This is the buzzer round now. Put your hand on the buzzer, just check it. I'm sorry, it's a simple buzzer, just you have to press it fast. Okay? Now I need a judge for this.
Volunteers, please. Be there. Check it out.
Okay? Come, you want to come? Who's the smartest? Pradnya. You're quite smart into this. Dr. Pradnya. Dr. Pradnya is a pathologist. Okay? Who you have to tell me who put the buzzer first.
Both. You are looking here, no? These two teams. And
just be closer to the bell, huh? Okay? Alright?
First you have to bang them.
No, not mic. After that we'll answer.
No.
Just be on your buzzer.
Hello, test. Okay.
Okay? Be on the buzzer. Alright? So this is the first question. Alright? Don't be on the mic. Keep your mic aside, okay? Just be on the buzzer. We'll get your answer later on. Come on, computer. Let's start with the buzzer round. The first milk coming from mother's. Okay?
D. Colostrum.
Colostrum. Okay? Let's seal the question. Absolutely right. Okay? Second question. Sertoli says.
Here, D.
Only one.
D.
What's the answer?
So option A, seminiferous tubules.
Option A, seminiferous tubule. Let's select option A. Perfect. Next.
D. Yeah, come on, answer.
So option C, glans penis.
Option C, glans penis. Can we have the answers also? Absolutely wrong. Okay. So minus this round. This is the only round which has minus negative marks. Huh? Minus 50. Next question, computer.
Option D.
Option D. Let's have the answer for option D. Absolutely right. Okay.
Option D.
Option D. Computer, please seal the answer. Perfect. Option B. Computer, please seal the answer. Option B.
False.
False. Let's seal the answer. False. Very good. Next. Your answer? Press, not press. You pressed.
So C.
C. Pituitary tumor surgery. Wow, what a complex answer. And it's the right answer for you. This procedure is, you see the procedure? What is this procedure? A, B, C, D. Nobody to answer? Okay. All right. This procedure that you saw is a very new procedure wherein you do these counter pulsations in your legs and you improve your heart. Without a surgery, without angiography, angioplasty, nothing. What does it do? It gives you increases heart circulation at a particular time of the cardiac cycle. With that, slowly your heart improves. And we have this in Panjim, recently put up into our new VRUNDAVAN daycare center. And you do not need a surgery. This is what you call it as EECP, Enhanced External Counter Pulsation. Okay, so this is a very new process and it's a fantastic process which have increased the lifespan of our heart patients to a very large 10, 20, 30, 40 years they are able to go through. Okay? Yeah. Thank you so much. Well, let me tell you, after this round, except for one, everybody of you have tried to answer these questions, which half of my doctor friends will not be able to answer. And Dr. Pradnya will definitely tell you about it. They are tough answers, and I'm sure it's not difficult for all 8 people to be successful doctors tomorrow. All right? Let's think, what do you rethink after that? All right? So now, let's give a rest to our audience. Okay? If you want to just quickly go out and come, you can. And I will give, now this round is only for audience.
We'll go fast.
Yeah, we will go fast. Yeah. Subhash is already telling me go fast.
No,
come on, let's have this audience round, okay?
No break.
No break. Okay, no break. Keep all the prizes ready. Audience round this is. Okay? A medical term, golden health is used in relation to what? Okay? See, somebody answered well, but everybody answered. So no prize for that, okay? Somebody has to say what it is, okay? So no prize for this. You just answer offhand, no. Okay? When any disease spreads across the world, it is called what? Okay? Pandemic. Come on, yes.
Pandemic.
Mike.
Pandemic.
Give more now. More. 8 of them. Who's going to give this prize? Come on. Pradnya's father will give this prize. Is it right?
Yes.
No. Computer has to tell me. Okay, it's. Okay, next question. Swine flu is caused by B1. B1, N1, H1, N1, T1, N1, C1, D1. Very few hands, huh? Come. Come out, take the mic and answer. Say your name, say from which college you are.
Satoshi Naik, Government High Secondary School, Penning.
Very good. What's your answer?
Option B.
Option B, H1, N1. Perfect. Okay, Shobha. Okay, let's go to the next question. I won't give, Subhash is not allowing me to have discussion. In case you want, you can ask later on, okay? Influenza disease is caused by bacteria, fungi, protozoa, viruses. Come, you've been raising a hand on everything.
Myself, Shravani Ramdas Sudhir from SS Sangli. The answer is option D, viruses.
Option D, viruses. Computer, is she right? Yes, of course. The principal. Next question. Chikungunya is caused by viruses, nematode, fungi, bacteria. Very common disease in Goa these days. Chikungunya, very common. Okay, only 2 hands. You have answered 1. Okay, come on. Come this side.
Omkar Sarkar from Shri Bhumika Higher Secondary School, Pariye. Option B, nematode.
Nematodes. Chikungunya. No. Sorry. Who has not answered? You have not answered. Come on. Yeah.
Sara Naik from Government High Secondary School, Penning. Viruses.
Viruses. Computer. Perfect. Come. Next question. Which of the given disease is caused by protozoa? Who's not answered? You answered. Yes, you have not answered. Come.
Default is from Damodar High Secondary, Gudi Paroda.
Malaria. Computer, is she right? Perfectly right. Come. Salak. Next, alcohol detoxification is done by lungs, kidney, liver, intestine. Yes. Come this side properly.
Bhumish Shelbawkar from PMC High Secondary School.
Okay. What's your answer?
Option C.
Option C, liver. Okay, computer, it's right. Come. Who's going to give? Rameshwari, where is she? I have not found her. Come here. Hiding coolly. Your whole efforts has been done headed by Rameshwari and her team. Okay. Now next is brain of the cell is RNA, cytoplasm, nucleus or cell membrane. Come on. Okay. Yeah, give it.
I'm Vaishali Naik. I teach in People's Higher Secondary. Answer is cell membrane.
Cell membrane. Perfect, okay? And if you go to your net, they will always say it is nucleus is the cell, is the brain. You would like to have it from me? Come on. Come up on top. See, everyone says nucleus is the brain of a cell, which is totally wrong. We have removed the nucleus and the cell can survive as long as possible. But you make a small hole into the cell membrane, the cell dies. This itself tells you that nucleus is not the brain of the cell. Nucleus is only the gonad of the cell. Okay? Congratulations. Okay? Here is a teacher taking away the prize. Yeah. People have been okay, not there on the.
No, they are team.
Oh yeah, your team is here. Wow. Okay. Breast cancer is genetic. True or false? Come. Mike. Please, Mike.
Sagar Shergaonkar from DMC Higher Secondary. Teacher.
What's your answer?
False.
False. Okay. Computer. Perfect, sir. Okay. Pandita Pradnya.
Mike.
Mom? Yes, of course. Come, Namita. Principal madam has given. Yeah. There are a lot of things about breast cancer. There are sisters who got breast cancer. Sister 1, sister 2, sister 3. All three dying of breast cancer. But still it's not genetic. How does it happen? What did I say just now? There is no cause for cancer. It's your mind, which is scared of cancer. All the time I'm thinking of, okay, I should not get cancer, I should not get cancer. In the bargain, you are creating cancer in your body. Okay? I don't have much time now to keep on explaining all this. Alright? So, this is over. Now, let's go to let's go to T20. Are you ready? T20 cricket. You will get 10 questions. You have to answer them in 1 minute's time. Okay? Each team will get 10 separate questions. Okay? There are no negative marks. Okay? Come on now. You are keeping the timing? Very good. Fastest minds first. Okay? So, let's have a questionnaire for team A. You have to keep on answering, huh? Yes, no, yes, no.
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 Skip. 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 No. Skip.
Yeah. Subhash said it.
Yes. Yes. No.
Stop, time's up.
Stop. Okay. Now let's see the answers. First answer wrong. Second is wrong. Third is not answered. Fourth, fifth not answered. Sixth answer correct, 100 marks. Seventh not answered. Eighth is correct, 200 marks. And the ninth is correct. And 10th is correct. Right? How many? How many correct? 4 correct answers. So she gets 400 marks. Okay? Out of 1000, you have scored 400 marks this time. Okay? Let's go to team B now.
Yes. Yes.
Yes.
Yes. Yes. Skip. Yes. Skip. Yes. Yes. Tenth, no.
You still have time.
Ninth, no. Seventh, yes.
Stop.
Okay, let's see the answers. 1 correct, 2 correct, 3 correct, 4 correct, 5 correct, 6 correct, 7 correct, 8 correct, 9 correct. Okay, how many wrong?
5 is not answered, no?
5 is not done.
Yeah.
5 is not done.
So you have 8 correct answers. Okay, so you get 800 marks. Very good. Now team C.
Yes. Skip. No. Skip. Yes. Skip. No. Yes. Yes. Yes.
You still have
Fourth
time.
one. No.
Stop.
Okay. Answers please. 1, 2, 3, 4, 5 right. Okay? Okay? You're 5 right. Now the team D. 4 right? Okay? 4 right. Now let's come to the team D.
No. Skip. 4 is yes. 5 is yes. Yes. 6 is yes. 7 is no. 8 is no. 9 is yes. 10 is yes. 2 is no. And 3 is yes.
Still time. Quickly, they're very, very quick, huh? Disha and Savi.
Time's up.
Okay. So now answers. 1, 2, 3, 4, 5, 6, 7, 8, 9 correct answers. Give me the final answer. Who's the winner? Friends, I'm amazed looking at the information, looking at the education, and looking at these youngsters the way they are. And especially those of you who are going to go into medical, you will surely go into medical and you will become extraordinary doctors. These questions were not simple. And this time I'm going to take the same questionnaire to the doctors. There is a program where I'm not going to even change it. I won't tell you where it is, but I'll take this to the doctors. I'm sure doctors will not score these number of marks. Okay. Now, let's come to this. Team C gets 900 marks. Okay. Team A gets 1200 marks. Team B is 750 marks. 1750 marks. 1750 marks. Okay. And Team D, the winner is Team D. 1800 marks. It's almost all of them. Almost very, very close to each other. You're all winners. You're all good. You're all excellent. And I'm sure in medical life, if you go ahead, you will definitely must be doing much, much better. Much better. Let me tell you, these were not simple answers. Last year I created a lot more simpler answers. This time I said, let me create a very tough answer. Even in NEET, these are tougher questions of even NEET. Okay? And congratulations, Sanvi and Disha. Okay? Congratulations to you. Over to Subhash. Sorry, I still took a little longer time from you.
Okay, as doctor was pointing out to me, let's have a little break of 5 minutes for a cup of tea. Tea is ready. You can please go there. By the time we'll just set a small dish arrangement. 5 minutes, just 5 minutes, and come back immediately. Those who want to have a cup of tea and